Good morning, everybody. My name is Juan Gallardo with iPros Insurance Professionals, and welcome to today's session of iPros TV. Today's session will focus on partnering with health plans and Medicare groups specific to the Medicare Advantage products. We have three very knowledgeable panelists that we providing us with very valuable information on why it makes strategic sense to partner with these groups in your respective territories. So we're going to take a brief pause so we can bring up the presentation and we'll get started. Thank you, everybody, for your patience. I wanted to recap a little bit on our prior session, which really focused on working with individual PCPs. Everybody that works with iPros knows that a large percentage of our production of our leads come from working with your local grassroots-based providers, your primary care physicians. So I want to recap on that first session. In fact, by popular demand, we're going to have this session again at the end of this month so that we can go over that. But wanted to recap so that it's a segue to the next session, which is really around the importance of partnering with your carriers and IPA partners. So in the last session, we talked about mapping out your provider visits. It's important that we identify your providers within a 5-mile, 10-mile radius to make sure that you're using your day effectively when you're mapping out your territories. We also provided insight on the elevator pitch, the introductions. A lot of times when you're visiting providers, you only have a couple of minutes to really provide your value proposition to either the office manager or the individual PCP. So we covered the importance of really preparing yourself so that you're saying those strategic words, those key phrases that are going to catch their attention. We talked about best practices, having your materials ready, having your business cards available, samples of your flyers, etc. We talked about the value of creating your lead pipeline through working through individual providers. And we also touched on marketing and sales tools that are available not only through iPros, but through the health plan carriers, through their online portals and working with the health plan representatives at a local level. So we're going to have this session once again at the end of this month. And today's session on working with carriers and IPA partners is in follow-up to that session. So as part two, we have three important panelists that are here today. One of them is Debbie Montalvo, Senior Regional Medicare Broker Sales Manager. Good morning, Debbie. How are you?
Good morning.
Fantastic. We also have Christian Videa, VP of Growth and Operations for Superior Choice IPA, along with the CEO of Superior Choice IPA, Bobby Pezeshki.
Dr. Bobby Pezeshki.
Pezeshki. Thank you so much for joining us this morning, both you and Chris and Bobby.
Thank you all.
So before we start, I'm going to go ahead and give you guys some background on Debbie. Debbie brings 2 decades of experience in the healthcare industry, specializing in Medicare. Her expertise spans Medicare Supplement, Medicare Advantage, and Duals plans. She has been instrumental in driving the Medicare Supplement program and a #1 ranking in 3 consecutive years. She's a visionary, and we know that firsthand, as a leader in go-to-market strategy. Debbie has shaped effective approaches for reaching target audience and driving sales. Her passion lies in being instrumental to success, whether it's for an agency or an individual agent. Next, we have Dr. Bobby, as they know him in the marketplace. He's the CEO of Superior Choice IPA and Centro Médico MacArthur Park. With a decade of executive leadership in managed care, he specializes in Medicare and Medi-Cal services. Dr. Bobby spearheads physician recruitment, network development, and Medicare growth. Under his guidance, Superior Choice IPA membership has reached 22,000 plus members and continues to grow. He mentors physicians out of UC Irvine and has a master's in public health, very impressive, from St. George University. And he is dedicated to expanding access to quality healthcare for all Medicare patients. Christian Videa, also a veteran of the industry. Chris is a seasoned professional with over 25 years of experience in business development, clinic operation management, growth strategy development, and IPA operations. Throughout his career, he has demonstrated expertise in customer relationship management, process improvement, and change management. Chris has consistently contributed to the successful launch of numerous initiatives, including new market business development and growth strategies, physician integration, network analysis, and program implementation. So welcome to the three of you. Today's session, we're going to talk about, once again, from your point of view, from your experience, what makes a successful agent? What makes them stand apart? What are those characteristics that you've seen that are those agents that are the top producers? And we'll start with Debbie Montalvo on what makes a good agent. And the first question that we have here is, let me see here. What do you feel is important that an agent strategically partner with a health plan representative? We'll start with you, Debbie.
Thank you for having me here. And, just to start with this, it's important, and I'm going to start with what I believe on is called discipline. Discipline is number one. Consistency is called routine. And to be visual constantly. I think the relationship as a partnership, when you work with a medical group or with anyone in the community, if you have discipline, it's not motivation. Most of us get up in the morning, we don't come out and say, I want to do this, get up at 5 a.m. and hit the gym. No, it's called discipline and routine. So every time the person, if you work with a clinic and a medical group, they want you to provide reports back, be able to have consistent messaging in their offices with their staff and services. The success of many agents that I've seen them grow from starting, there's some that start up very quickly, they adapt very quickly, and they're able to exceed. And in open enrollment, a new agent could bring between 200 to 300 lives because of that behavior that actually starts early on throughout and be able to have the follow-up, the admin, the responsibility. So I think the three things as an agent, if you are starting and if you're already a seasoned agent, if you don't have consistency, and pick the region that you're good at. We cannot cover the entire LA County. Perhaps you pick three cities or 3 areas where you could be good at. So those are my tips that I've seen a success of many agents do very well.
Thank you, Debbie. And we touched that in the previous session. We talked about a 5-mile radius. We've seen from our top producers that that's the best time spent, right? Within a 5-mile radius, we know that within the day you can visit 5 to 10 providers as long as you stay within those geographical areas. Moving on from an IPA's perspective, you talked about enhanced member experience and retention, Chris. Can you elaborate on that?
Yeah, absolutely. Well, firstly, thank you for inviting us here. It's great to be here with everyone, and thanks to everyone who's making the commitment to be here and allowing us to share this information with you. Like you, we are in the service industry. When I talk about enhanced member experience and retention, like you, it's important. We do not survive without retention. We bring patients in, which is a great thing. We rely heavily on all of you to do that for us. It's extremely important then, and our responsibility as well as yours to help us retain patients. So part of that is really connecting you with some of the team members that we have within the IPA, really understanding who's handling the marketing, who's handling the business development, and also who's handling the physician representation, who's representing the physician. So part of that is our provider relations team is critical for you to know. Part of that, we work at introducing you with all the leaders. Most importantly, Dr. Bobby. You can see Dr. Bobby here with you all. Our leadership is an organization is physician-led, which we'll talk about in a little bit. But I think really enhancing that experiencing and knowing how important membership retention is for us as an organization is critical. That's number one. Number two really is by partnering with us, we help accelerate your growth. Our folks out in the field really do a great job at identifying doctors that are interested in growing. What phase are they in growth? Are they a brand new physician, just bought a practice, opened the practice, which will require different types of marketing? Or are they someone who's been in the business for quite some time that's really looking to continue to grow with Superior Choice Medical Group? So when we look at that, we identify those and we work closely at identifying people in that area. As Juan mentioned, we also look for folks that live in that area. That 5-mile radius is key for us because once again, if a physician's office needs something, it's extremely important that you can get there quickly or you can respond to that need immediately. That's what physicians tell us they want. That's what they tell us that they like. So knowing who you're working with, working in tandem, in collaboration with your IPA is extremely important. And the last piece of it is really, facilitating introductions. On our end, as an IPA, we continue to grow. We continue to grow within the LA market. And with that, we need your support. We need to identify brokers that are engaged and are willing to work and go that extra mile to really support our physicians.
Thank you, Chris. I think you both, we asked you to respond prior to this session, and you both hit on building that trust, becoming a trusted source, right, Debbie?
Yes.
And can you elaborate on how an agent can work with your broker reps to become that trusted source, not only with the IP networks, but with the PCPs in the community?
Yeah, that is key. The trusted advisor. The trusted advisor that it comes and three things that I think that a trusted advisor needs to be able to do. First of all, as an agent, minimally 30% of your time, you should constantly get yourself up to speed with what's happening in the market. The providers, they don't have the time or even the community to know what's happening. They don't know until everything gets released to them. So as a medical advisor, I suggest you invest a little time and always reading, getting yourself up to par, what's happening in the marketplace, what could impact your consumer. We have the CMS final rule coming in. I'll give you a perfect example. Agents should be already know the impact and study about it, and you should have like either an article or always something to bring it into the doctor's office and say, by the way, let's start working on our retention on pharmacy. Pharmacy is going to be key in order for you to succeed. So that person as a trusted advisor is going to refer to you 10, 15 more clients coming in to you to make sure you provide that service at that location and provide in the community. But I think 30% of your time, you should definitely invest time on getting yourself up to speed, not when the information's already released, but information's been out there already. But you definitely need to help doctor's offices, physicians, in a sense that you come in with in-services to letting them know what the impact is and how can we plan ahead. I think that's the key of a trusted advisor, and being ethical, always integrity. Doesn't matter what happens situation, but learn to walk away from the business, and your reputation goes a long way.
If I may, in order to be effective in growth and communication, there needs to be the synergy between the Medicare agent, the Medicare agency, the health plan, the IPA, the PCP office, and the supportive staff at the clinic. That's the PCP office that's being serviced. There needs to be coordination, there needs to be communication, there needs to be collaboration, and cooperation. There's a huge plus in communication. If challenges come up, there needs to be meetings, you need to troubleshoot, and there needs to be all hands on deck on how to overcome challenges that would be conducive to growth, whatever that may be. Transparency is key.
Well said, doctor. And I think agents underestimate their role in this ecosystem that we work in.
Absolutely.
And we talked about that in our first session that we had, our previous session and we even had a diagram which demonstrated to them where they fall into this ecosystem. So partnering with a carrier, understanding the carrier's network, the carrier's value proposition, partnering with them to attend strategic meetings to build credibility as an expert in the market, working with the medical groups, the IPA, so again, network, the benefits, authorization processes, et cetera. What's happening in the marketplace that's not only impacting agents, but in turn impacting medical groups and carriers. So very important. Next question that we ask is, how does this benefit both parties? Because it's a reciprocal relationship. And I'll start with Chris on this one. You talked about increased patient enrollment, improved provider-patient relationships, and enhanced brand awareness. Can you elaborate on that?
Yeah, absolutely. So, I think Debbie touched on this a little bit. When we talk about patient enrollment, why are we in offices? Obviously, it's a win-win is what we're looking for. We're looking for agents to be the most productive when they're in office. And part of that is really, how do you improve patient-physician relationships, right? From an agent's perspective, that may not always be clear. But really, what COVID has shown us is physicians are relying on us more and more. Physicians are really relying on the broker agent to be an extension of their clinic, if you will. So part of that means you are there to address any potential issues before they happen or as they're happening. So you are viewed as an extension of the office in that sense. So really, when I talk about improving provider-patient relationships, from a patient's perspective, they don't always understand what's causing a problem, where it's coming from. They don't understand what the referral process looks like, what the benefit structure is for the health plan. And that's really where you folks come in and really work closely with the patient. You're closely connected with that patient. You've worked to establish that relationship with that patient as well as the physician. So once you do that, the physician sees you as a value-added member of their team, and as well as the IPA. Right? You know where to go. You know what resources to use. I talk about increased patient enrollment. Once again, I cannot stress enough the importance of retention. Increased patient enrollment in the sense that we are identifying these physicians for you, getting you in front of these folks, and it helps establish your brand. Right? You are a brand. When you walk into an office, the way you come in, the way you introduce yourself, the way you present yourself, that is your brand. But not only are you representing in that moment your brand, but if there's an introduction from an IPA, you're also representing the brand, that IPA brand in that moment.
Thank you, Chris. Going back to, and I keep referring to our last session because all of these are meant to connect. We talked about the health plan because the health plan has a responsibility not only to the member, but to their network. And then from a network perspective, in addition to delivering care to the patient, we educated them on the capitation. What is capitation? Because I think it's important that agents understand the capitation world and, again, part of that ecosystem. Can you tell us a little bit about, without getting deep into any financials, but explain elaborate a little more on the capitation process, on system. How do you work with your physicians? Sometimes they're specialists. If we're working with a particular PCP, there may be a specialist that's not part of the network. How do you work with agents to troubleshoot those instances where the specialist is not part of the network? I think that's important as well to touch on.
Yeah, absolutely. It's a great question, and I recall many moons ago when I was on the other side and first started my career selling for a health plan. I had to learn all of that as well, and understanding why can patients not go to a certain specialist, et cetera. So I feel the pain of having to learn that and understanding networks. There's different relationships when you talk about specialists and contracting with specialists. You talked about the capitated model. Capitating specialist, meaning you are paying a set fee to a physician, a specialist, whether they see the patient or not, right? A monthly fee per member per month, you're paying the specialist to be available for that patient as needed. On the other end of it, we have a fee-for-service relationship. They have their pros and cons. On our end, we like the fee-for-service model for our specialists. We like the idea of giving our members flexibility. So what that means is with a fee-for-service, as long as a physician, a specialist is willing to contract with us, we go out and contract with them, not only through a traditional contract, but we also do letter of agreements for our specialists. So the flexibility of a patient saying, I see Dr. Pezeshki as an example as my endocrinologist. If they are not part of the network, understanding what medical groups offer, what the benefits are from each medical group is important. There's 50 plus medical groups within the LA market. It's important to know what they offer, what the relationships are, how flexible are they with your patients, because once again, that's going to be tied to patient satisfaction, which is becoming extremely important in 2024 and moving forward. So on our end, as I mentioned, the fee-for-service model that we use for our specialists is extremely important because it allows that flexibility. Other models, once again, use a capitated model where patients are asked to go to a specific group of specialists to seek care.
And to add to that, part of public health initiatives involves continuity of care. That is huge, continuity of care. If a patient has excellent rapport with a specialist, even a hospitalist, then you don't want to interrupt that as an IPA. Superior Choice never or strives to never do that. one of the first things we do is when we contract, even before we contract with a PCP, we get their specialist list and we at least try to get a letter of agreement which will expedite the relationship on a temporary basis until we can bridge it to a specialist contract. What that allows is that PCP can work with whomever, whichever specialist that they choose, that they have an excellent relationship with, that the patients that are going to be moved to the new IPA can continue with that specialist, and it streamlines it and it eases it. That way care is not interrupted. That way the patient doesn't have to start all over with a brand new specialist. They could go to the specialist that's within a few miles from their home. So it's all about increasing access. If you want to have the highest quality outcomes, then you need to increase access and lower barriers. And that's what Superior Choice stands for.
Thank you, Doctor. Speaking of networks, building networks, Debbie, can you touch a little bit on Blue Shield's philosophy as they built out their network, the member experience, especially specific to the Medicare Advantage product?
I think Blue Shield California, again, just Service California, we've known for our network. Our strength is our network. All the counties we always support, make sure there's adequate network, including with Medicare. You have to have adequate network for you to be in those counties. But beyond that, Blue Shield takes another step, kind of having a commercial line of business, IFP, Premier Core, and everything else. We align our groups in the sense that we have access of the elite hospitals and groups that work with us. One of the things I want to elaborate on, as an agent, right? I'm putting my hat as an agent. What they offer for you with Superior, it's elite, right? They're able to go fee for service, do beyond that. And many groups have different rules that we have to sometimes, as an agent, I could provide you a screen that has over 30 groups. Then you have to be able to navigate, understand each of them, because I want to bring CMS, right? Mm-hmm. Then CMS comes in and then you get an allegation because you told the client that you could have that specialist, and the allegation comes to you 6 months later that was not accurate. So I think working very close with the groups that you work with, getting the relationship with our local broker managers within Blue Shield to confirm if that actually provider is in the network. Blue Shield is able to enhance, and we want to increase the relationship with not just with the member, but with the broker too. The experience to be able to have adequate providers online. About 3 years ago, Medicare had a regulation that we had to print directories monthly. So if you do have a directory in hand, make sure that it's outdated by the time you print it within minutes, because the data has to be online. And once you look into that, the experience of the consumer, it's big. And just to touch on retention for Blue Shield, we have an internal team that touches all the Medicare lives. Doesn't matter what product they have. If it's been a little over a year, it's been a success within Blue Shield. They are in constantly contact doing campaigns. So sometimes if an agent's busy, they're not able to reach out. They only sending a letter perhaps during AEP, right? They're prepping, and they don't realize that Blue Shield for us, we actually are touching those lives every month. We're constantly having campaigns. We want to make sure that our Net Promoter Score keeps increasing, that experience with our consumers, but then also with the broker. So it's a hand in hand. We go together. And with Blue Shield, I don't have captive agents. I was just sharing with you. The agents are, our Blue Shield agents out in the field. So we want to make sure that you have the most accurate information. I would recommend please always use an online tool. And if you don't see something there, contact the group, contact the carrier, so we could make sure that the member doesn't have that experience of not having the specialist.
And we do have new agents to iPros, new to the Medicare industry. Just to elaborate on the captive model, this would mean that the agent is an employee of Blue Shield, and it specifically only sells for Blue Shield. So in a sense, you're competing out there with captive agents, internal sales teams, right? So for Blue Shield, they do not have a captive team, so they depend solely on the agents. You on this seminar today, as their distribution channel to bring those Medicare
in the
Advantage
field,
lives.
Absolutely. And we protect the broker record, and like what we're saying, retention and having all those things. We just Service California, but having that will make you succeed. And with the brand of Blue Shield, we do have a high 94% retention rate.
Awesome, awesome. So just to clarify, earlier I mentioned around the LOAs and working with an IPA in particular, it's really around once you build that relationship and you're the liaison between the PCP and the medical group or the IPA and the health plan, is really facilitating those contacts, right? Putting the office manager, the physician in contact with the superior choices of the world when they need an expansion in a network as far as specialists. So we're not, as agents, we're not doing any contracting. It's connecting the dots, right? You talked about becoming that ambassador, right?
Correct.
So just to clarify, there is important. Next question was, in your experience, what are the characteristics that make up a good Medicare agent? I've been doing this for 35 years, and part of that 80-20 rule where 20% of our agents are really the ones that bring in the production, those 20% have specific characteristics, and they all align 90%. But it's great to hear from your perspective, from your observations of those agents that you work closely with, what sets them apart. And we'll start with Debbie first. And your first response was integrity with their clients, business partners, and community. Can you elaborate on that?
Integrity, we talked about, that's key. It's the trust, integrity as an agent. It's a small industry. So we connect, we have a meeting, and we say, oh, do you work with Jones? Oh, yeah, absolutely. The integrity, if it doesn't work out, what about this? Oh, no, never follow through, just had a bad experience. Integrity, what you do from the beginning, it goes a long ways with the provider, with the network, in that community. And like I've been doing, I can't even tell you, I've been doing this since 98, right? Probably giving away my age, but I've been doing this. I started when I was 2. Okay. But I could tell you that for myself and all of us here in this room today, all those years, many years, 10, 20, 30 years later, we always come back to the person. I reach out to Juan. What can we do to strategy? What can we actually work together on something to grow? Because that's my partner along the lines to grow with our community. So you as an agent should be doing the same. Integrity goes a long ways, and your name, your reputation, it just carries on.
Thank you for that. Number 2, you responded, exceptional agents deliver on their commitments and are consistent year-round and have a retention approach by sending out their birthday cards, check-in middle of the year, a needs assessment with their current members, and review the different plans. Elaborate on that.
It's something that I believe it's a year-round. I sometimes get approached and they tell me, I only work AEP. No. As a carrier and a provider, I could tell you the partner that we want to have next to us growing increasing our growth is someone that does this year round. Medicare has definitely changed the pace. I think many agents that work, duals, or they work their T65s, or they're doing different campaigns, but it's doing it year round. So when things start ramping up, that is the loyal partner that's been with us throughout. Sometimes it'll be very quiet, very slow, but that doesn't mean that you leave the campaign and say, I went there twice, no one showed up, I'm not coming again. You're gonna have to go there 10 times, and you're gonna have to find a way to make it work. And the beauty is digital marketing. After COVID, I think that things have evolved as an agent, that you're able to touch and reach additional things. Within Blue Shield of California, we have a digital platform that you could promote, the call to actions to call you. We have YouTube, we have Facebook, IG. You're able to actually have ads already approved that you could add. So for me, Juan, I could tell you that is something that the birthday cards are great, right? Mm-hmm. That's something that's like old school, but it's still traditional. It still works. I don't think people should stop doing that.
That human touch, right?
Yes, and you still have to, so when the senior opens their phone, they probably didn't even get a birthday from their loved ones. They probably don't have someone to be able to have that social impact. So for me, I still think birthday cards work. It's something that, my birthday's coming up. I'm already getting stuff coming in and for free, by the way. So I'm all happy about it. But do the reach out and retention, and make sure that every time you ask for referral, at the end of every email you have to say, please send me your clients. I'm your trusted advisor. Always ask for a sale every conversation, either you do digital, either if you do email or conversation.
Thank you, Debbie. Dr. Bobby, if I may, you're one of those leaders in the industry that actually rolls up their sleeves and gets out there. I know that we've had several meetings with you, and you actually take the time not only to meet the agency principals, agency management, but also get out there and you meet those individual agents that are making the difference. So thank you for doing that. Absolutely. Thank you for recognizing our efforts. Can you elaborate a little bit on your experiences as you're meeting these agents out in the field? What are things that catch your attention?
Absolutely. I think what she mentioned was excellent. I do think that integrity is probably one of the most important things. I'd like to add consistency and having that warmth about you. And I'm tying them in together. And the reason is the following. The older generation is prior to the digital age. They're not the type that you usually text or for example, the remote kind of relationship. The older generation, they like to see you in person. And that's how you build loyalty. They want somebody that they can trust, somebody that they can lean on. You want to, as a Medicare agent, to be successful, you want to act like this particular agent that you're servicing is your grandmother or your great aunt. You want to be like a family member to them. You want to be their rock. If they have a question, you're there for them. Doesn't mean that you have to do their chores for them or things like that. But that, for example, if they're not bilingual and they don't understand English, maybe sometimes they can come to you. You can help them with letters. Maybe you can help them with dental referrals. It's the little things that you do and the things that you do on a consistent basis. And if you do it face to face, that is the extra credit that will get you that loyalty. And if they know that they can trust you, you have them for life. And that is very impactful. Unfortunately, during COVID, we've noticed that a lot of Medicare agents are working remote, and I can understand that, and they've gotten used to it. But if you really want to get that loyalty, if you want that growth, you want that retention, it's better for you to go in person. Whether you want to go into that doctor's office and be, for example, what Chris said, be an extension of that doctor's office, that is going to be the most effective. And while I'm talking about that, a lot of these doctors' offices, especially post-COVID, have had a lot of turnover. That's just a fact of life. In any industry, if you're going into, for example, a Cheesecake Factory or any other industry, turnover nowadays is a lot higher than it was pre-COVID. That's just the culture. Culture has changed. So for your going into that doctor's office, it helps you keep that adhesiveness with that doctor's office. Whether they have a new manager or they have new front staff employees, that keeps you engaged, not only with that patient, but also with that doctor's office. So you get their support and they know who you are. That's very impactful. And that involves consistency. It ties into kind of what she was saying in terms of only working during AEP. That's not going to work. You have to be on it. And you have to set some kind of a set schedule. Now, it doesn't have to be every week, but if you can have some kind of a predictable schedule where you show your face and you roll up your sleeves, you're active there with the medical clinic staff. Oftentimes these clinics are short-staffed. That's just the industry, the way that it is now. And say, hey, how can I help? They value that, and the patient will value that too. How can I help you as well?
That's so valuable, and for those agents that are here with us today and are listening, that consistency is key.
Absolutely.
Out of sight, out of mind. So as partners, this communicates to you that not only the health plans, but the IPA representatives are also they're watching for that consistency.
Absolutely.
Because at the end of the day, if you're introducing us or we're going together to these meetings and attending these meetings, we're a representation of you. We're an extension of you, right?
Absolutely.
So if we drop the ball, in a sense, we're dropping the ball for you as well, right? So that consistency is so key. Chris, turn it over to you. Subject matter expert, very important. Talk to us about that.
Yeah, absolutely, extremely important. Most of these offices, they don't understand the difference between all the products that you represent. Patients definitely will not understand that, especially with the turnover. With the turnover that we're seeing in clinics right now, you're getting folks that are coming from outside the medical space, right? And they're trying to understand, What is eligibility? What is a referral or an authorization? What does all this mean? So it's a great opportunity for you to really step in as a subject matter expert and explain these things to these folks. As I mentioned initially, that the connection that you build with that office is extremely important. So being a subject matter expert, do you understand what resources a patient has available to them? Where are the local food banks for some of those folks that may be struggling a little bit with food insecurity? When you talk about understanding different enrollment programs, a patient that doesn't have Part A or Part B, what kind of programs do you have? Quimby and Slimby as other programs that you might be able to still help that member get into a managed care product. These are the types of things that are extremely important. Understanding, Debbie touched on it with the very first question, understanding what's happening in the industry is critical. Right now, there are huge changes in the industry. There's a lot of consolidation, health plan consolidations, medical groups buying one another. There's a lot of changes that happen with that. So understanding what the impact is to your patient is extremely critical. I say don't wait until you get the information. Ask these questions ahead of time. Ask these questions of your IPAs. Ask these questions of your health plans. So that way you can get the answers that you need to better serve not only your patients, but also your physicians.
Such valuable information. It just struck me that we should call this a master class, right? Because it's such valuable information. Yeah. 3 veterans of the industry that have pretty much seen it all. So hopefully our agents really take this into consideration. The next piece, and this was provided by you, Chris, as part of the responses, and it applies to both the carrier and the IPA. It's open communication, both open communication with the IPA representative as well as your health plan representative. If you don't mind, I'm going to read it because I think you captured it very well. Effective collaboration with IPA representatives is crucial. Regular communication fosters a strong partnership, enabling agents to stay informed about plan updates, provider network changes, any issues that might impact their patients. Agents also share key metrics like the number of enrollments they brought in each week, each month, demonstrated their value and commitment to the partnership. Elaborate on that, and I'll turn it over to Debbie because this very much so applies to the health plan world as well. But you want to go ahead, Chris, first?
Yeah, absolutely. On our end, we try as much as possible to put a physician on a silver platter for you. We have conversations with physicians. We have conversations with the ownership of said clinics, and we create these wonderful plans. And then we go ahead and say, you know what, we're going to go ahead and bring you an agent. We introduce the agent. Everything is going wonderfully, and all of a sudden, about a month in, 2 months in, we're seeing no activity in that office. Naturally, we're going to outreach to you as an agent and say, what's going on in that office? What we've seen, and I'll use it as an example, is I had an agent who says, well, Chris, I'm having a really hard time getting any enrollment. The front office staff isn't engaged. I try to engage them. I try to connect with them, and I'm having no luck. Well, that's 2 months worth of an agent's time that they were in an office and did not communicate their barriers and challenges with us as the medical group. We have connections with the doctor. Sometimes in some of these IPA offices, the doctor isn't as engaged or connected with the office. So we know who that gatekeeper is. So our ask when we talk about communication is let us know as soon as you're encountering any kind of issue. We're here to support you. We will go in this particular case, we went in, we talked to the physician, we identified where the barriers were. The physician, us as IPA leadership, went in and talked to the person who was the barrier, and we were able to, in this case, ease the burden, ease the pain, right? There was a misunderstanding from this person, not understanding how referrals worked. So once we were able to solve that issue, it was no problem. Very quickly, that agent started actually getting membership. So imagine had that agent immediately come to us right as they identified this issue, they could have quickly started to to start to enroll. They could have enrolled more patients, and we would have been ahead of the game. So communication, I think at that point is really critical. Our ask is always communicating to us as we do, with you. That's our commitment to you, is communicating with you. We communicate closely with our health plan partners as well, as far as anything happening, any barriers, any challenges. So I think that's extremely critical, and that's really what physicians are expecting as well.
So from an agent's perspective, when it comes to continuity of care, when it comes to things that directly impact the healthcare delivery system, your PCP, the IPAs that manage these networks, key part of becoming an agent is really having that open communication with the IPAs. And then you look at legislation, regulation, what impacts agents from a sales perspective, from a compliance perspective. That's where Debbie comes in and that open communication. Can you elaborate on that, Debbie?
Yeah, and then as an agent, you guys play multiple parts, and it's complex. Medicare is complex when it comes to regulations versus somebody that maybe sells Cover California, IFP. It's a lot easier to move things. The regulations force an agent to have something approved and to be able to go launch an opportunity. Sometimes could take 45 days. So when I say this about regulations and reporting, internally with Blue Shield, we have the reporting that comes in. It's in your client list. You're able to view that information, status of an application. But then you get the other requests from the group, right? How many enrollments are they in? What's going on? And we are not able to share the data, be able to share, hey, I got 3 lives this week, so on and on. A month later, the group gets the data and they see that there's no growth. Eventually, we all put the dots together. We contact each other. We meet on a monthly basis and we said, hey, the report shows the growth. Has it moved the needle? What's happening here? After we've done different strategies and we selected these agencies, what can we do different? But I could tell you that as a health plan, as a medical group, we're never going to ask for something to see overnight. It takes about at least 6 months to us to see the needle move. I've worked with an agency, and I want to share that with them, that I think it should motivate you. We've seen different campaigns that work, but if you work with a medical group of physician, then also set up a camp at a CVS or local retail in that area, because what they like to see is what's called organic growth. The flipping, the changing, and we could be transparent. Sometimes the groups are like, why did you switch this plan from this plan to the other, even though it's the same plan? It affects payment. It affects the structure, how that came about. So anytime you're working with the group, also share with the medical group and including the health plan for us. Besides the opportunity, we're collaborating together and we're promoting. We're also doing, within those 5-mile radius, something in that community. I think it's key to be able to have that relationship. But compliance is an issue, right? When it comes to all these things that you wish you could do. But at the same time, and the call recording got a little better, only when you do the point of sale. So as an agent, I do give shout out to you because you have to do many tools, but that's why you are aligning yourself with a key agency, with a partner, iPros. They do so much in the community. And I think even with the new rules coming into next year, it's the right agency you're with, because you need to get that one-touch lead that's going to be affecting that you're like, that's my lead, I work the lead. It's not something that you purchase. So keep doing what you're doing, but make sure it's compliant, it's approved. And your data with Blue Shield, I can only talk about for us, your client list information is in your fingertips on your client list.
Thank you, Debbie. We have 10 more minutes and we have so much information to share with the agents, so we're going to speed it up a little bit so that we get to the end of the presentation, and definitely going to name this the Masterclass series. So look for more of these, because it's just great information coming from these 3 panelists. Our next question is, what makes you and your organization a strategic partner for iPros agents? Debbie, you responded, deeply rooted in the community, actively engages in local events, health fairs, senior gatherings to generate sales. Grassroots approach stands out. A strategic partnership, successful collaborations with key medical groups and senior communities resulting in sales and opportunities. We've seen this firsthand. I know there's going to be some changes as part of this new rule that will impact at what level you'll be able to do this on an ongoing basis, but more to come on that.
Right.
We don't have all the details,
No.
but I'm sure for somebody that's been around for 35 years in this industry, there's always creative ways to not only comply with the CMS regulations, but find ways to be able to collaborate. Because I'm sure at the end of the day, CMS wants those agents with integrity, those subject matter experts to be out there in the community educating our seniors, because I always preach that we don't sell, even though they categorize us as sales. We don't need to know how to close for this product. It's really knowing your benefits, knowing your provider networks, and guiding seniors, our parents, our grandparents to the right plan, right? So elaborate a little more on what some of the things that you're doing now until the end of the year to support agents.
And I'll go back and talk to you and tell you that, first of all, we protect the broker record. This coming up in this open enrollment retention is going to be key. Blue Shield's already doing that for you. We already have the tools. But I still think that agents have to be able to enhance, even besides everything you do, grassroots is going to be key. That's going to be the source that you continue to working with a provider along the lines, not doing only health fairs, community, everything else in the retail space. But along the line, you have to be able to be doing your campaigns or your outreach digital. I'll tell you why. I'm going to close it with this one because I think it's key. I was a caregiver for my parents. Guess what? When an ad came in about Medicare changes, something is happening, I was the one to get those letters. I was the one to look in to see what's happening. So if you want to get referrals, you want to get sales, you want to continue to be there, the digital marketing next door campaign that Blue Shield has also internally our campaign, the call to action to call the agent, they want to do something local. Do an ice cream social, do something that a senior is able to come out there with you. But I think overall, within Blue Shield California, we do have the platform, the materials already approved. We have the product. In LA, we still have the HRA, or $100 that you could submit even within 90 days after the sale. So there's things in your fingertips that you could able to continue to grow. And the partnership with our provider is key. And the brand of Blue Shield will open many doors for you.
Thank you, Debbie. Moving on, we asked what makes you and your organization a strategic partner to iPros agents. So I'll start with you, Doctor. You touched on physician-owned and operated and direct access to leadership. So I'll turn it over to you to address these 2 points.
Sure. Well, let's start with the physician-operated and owned. Basically, we are Superior Choice has their own staff model clinic, and we also are the proprietors of these Superior Choice IPA. We understand the different facets of healthcare. We understand the operations of a clinic and the challenges that they deal with day in and day out. This includes the challenges during COVID and post-COVID. It has really impacted a lot of how we run our business. We understand how to coordinate with the health plans. We're very in tune with them. We are very engaging with the health plans. So it's really just kind of being able to relate to the primary care provider. We provide templates to the primary care providers. We can help with things that are not Medicare related that the primary care provider deals with. So that makes it a lot easier for them to work with us because it's all about support. Even if it doesn't involve Medicare growth, we want to be a rock that they can lean on. So as far as that, I'd like to add that we're all about ease of access and agility. Chris and myself, he's the VP of Operations, I'm the CEO, also our business development team, we have a provider relations staff. Every PCP, every staff member, as it pertains to Medicare lives, has access to our phone number. We give our business cards to everybody. If they have an issue, we encourage them to contact us directly. There's no bureaucratic process over here like some of the larger IPAs. We're very direct. We're very old-fashioned in how we manage our business. Every single capitation check that we deliver is hand-delivered with a smile. So you get that boutique service, even though we're not as much a boutique IPA as we were before.
Correct.
But we still have maintained that level of service that you don't get anywhere else. What am I also going to add about ease of access? Ease of access to specialists. I know I'm being redundant, but let's say you want to go to any, for example, we already touched up on the specialist. Let's also talk about ease of access to any hospital of your choice. We don't have a capitated arrangement with any hospital. Just as long as that health plan that that patient is enrolled in has that hospital contract, that patient could go to any hospital that they want to. But even the PCP that has a preference for a particular hospital list, we have contracts with all those hospitals and all those hospitals groups. So that should really facilitate it. Luckily, with Blue Shield, they are probably one of the most heavily contracted health plan in Los Angeles County. I can't even think of one hospital that they are not connected with. So that makes it, our synergy is excellent for that term and purpose. If a PCP has a question about anything or has suggestions on how we can improve our process, we are agile. We don't operate our business just because we've been operating a certain way for so many years. And if they have a compelling way on how we can improve our service and how we run our business, we're completely open to that. We go to dinners with physicians. We want to see them face to face. We work more like a team rather, for example, a separation between a PCP and an IPA. They're part of us. They're part of our core model.
Thank you very much. Debbie, closing out with you on the resources. We talked about your broker managers. How many do you have in the LA market in Southern California?
In the LA market, we have two, Eva Mendez and Mary Chang.
Both amazing.
Both amazing. I mean, Mary has been with Blue Shield for a little bit over 16 years. Eva Mendez is her other co-partner. She's been with Blue Shield actually coming to 2 years. But they have each of them have way over 20 plus years of experience. In San Diego, we have Chris Corso. He's a broker manager there. Christy Frasca, she covers Inland Empire and also Santa Barbara, San Luis Obispo, Kern County. And we also have in Orange County, our new addition, Michael Roberts. Michael Roberts, again, has over 20 years of experience also. And then we have Tammy Glauber, that she is in Northern California, and Eileen Rock, that she's in Northern California, Central Coast. So overall, we have a total of, 7 now, broker managers that just are local here to be able to help you. We're the addition, the elite. Some health plans, they say if you have to have so many lives to reach out to them. We really don't. We want to make sure that they're there for you, they're available. Any planning strategy that you want to do, please reach out to them. They have resources. We have retail through CVS. That if you have an opportunity that you want to expand yourself, talk to them. They're very knowledgeable.
They are.
I think in this industry, being led by Sandy Dalia, our AVP, and Marsha Davis, our director.
Shout out to Sandy.
Yeah, we've been, it's been a dynamic group, but we've been able to hit the market moving forward, and the stability of the plan. We may not have all those rebates, we may not have all these things, but the brand, the stability, and the brand of Blue Shield, and what we're able to exceed and to close 135% of goal last AP.
Yeah.
Even they're thinking where you're at doesn't matter. It's basically who your partner, who you choose, and who you want to be here for the long run.
Yeah, and that's key. Blue Shield, definitely a strategic partner. They've been in the market forever.
We're not going anywhere.
They're very consistent. I can attest to the high level of engagement from their broker team out in the field, as well as their leadership team. Like you, Debbie, we appreciate the support. Chris, how many business development reps do you have in the market out there? And also, if you can just touch on your geographical footprint for Superior, that'd be great.
Absolutely. So today we stretch across all of LA County. So we go from the Culver City area, we go east all the way to lovely city of West Covina, out this way. We go across through the 605 corridor all the way into the Los Alamitos area and the 710 corridor all the way into Long Beach. We have a small footprint in South Bay. We continue to expand, but we are looking to expand in other areas in the northern parts of LA County. So in order to do that, we do have 3 business development representatives that work closely with us. We've seen, as I mentioned earlier, a substantial growth when it comes to PCP contracts as well as specialist contracts. That is the team that works closely with you. We also have our provider relations team, as I mentioned earlier, that is out there finding new opportunities for all of you. So Dr. Bobby touched quite a bit on the fact that the two of us are really have our ear to the streets and feet on the ground. We like to understand what's happening in marketing, what's happening in growth, what's happening in the industry, how we support each and every one of you. That's our team in the LA market, and we see great things. Debbie mentioned that there is no interest in selling. As a Superior Choice Medical Group, we've seen everyone around our space selling, quite a few groups selling. There is no intention. The fact that we are physician-led, we believe that that's the model, along with the flexibility that we offer not only to our patients but our physicians as well. We believe that's the model for the future, and our goal is to continue to keep our IPA physicians in business.
Awesome. Well, we'll take that as your closing thoughts, Chris, and we'll turn it over to Debbie. Any closing thoughts for the team?
For the team, my heart goes out to you guys. You guys, what you do, my heart goes out to you. I've been doing this, like I said, very long time. We appreciate you. Thank you for all the business you've done for Blue Shield, and we look forward for the partnership. And Juan, to you, we always thank you for everything you do for us.
Thank you. Doctor?
Appreciate you. It's a pleasure.
Yes.
We're excited. So let's make this AEP count.
Yes, for sure. Well, want to thank our three panelists, just a wealth of information. We'd like to have you back. There's lots more that we can talk about as part of our masterclass series, because this is definitely can be considered one of those masterclass series. I want to thank all the agents for participating in this session of iPros TV. We hope you found it of value.
There is a question by one of our agents before we close out. Question by Aura 1. Can current member change agent of records? She needs assistant who can speak the same language and care for her.
That'll be a Debbie question, and we can take that offline as far as the Blue Shield policy when it comes to changing.
Protecting the broker record.
Protecting the broker record, which we know Blue Shield is all about that. But if you have any questions out there as it relates to partnering with carriers or IPAs for that matter, we have projects already. Executing on projects already, but with both Superior and Blue Shield. So if you'd like to participate in these projects, feel free to reach out to one of your team leads or myself directly here at iPros team or through our broker support email, phone number. We'll be more than happy to follow up with you and get you engaged if you're not already engaged. So once again, thank you so much for participating. Thank you so much to the panelists, and we look forward to seeing you in our next session of iPros TV. Have a great week. Bye-bye.